So Donald Trump wants to make drugs way, way cheaper for Americans and way more expensive for everyone else, with the president today announcing an executive order that's meant to bring pharmaceutical prices down in the states.
But starting today, the United States will no longer subsidize the health care of foreign countries and will no longer tolerate profiteering and price gouging from Big Pharma. But again, it was really the countries that forced Big Pharma to do things that, frankly, I'm not sure they really felt comfortable doing, but they've gotten away with it.
So the order, it does a few different things, starting with a directive to HHS to set targets for drug price reductions for publicly insured health programs and private markets in the United States within 30 days, which should kick off a round of negotiations between the federal government and drug makers. Next, the Justice Department and Federal Trade Commission are directed to stop anti-competitive practices. And finally, HHS will facilitate direct-to-consumer pharmaceutical sales at most favored nation prices, with Trump also notably continuing Biden's policy of negotiating lower drug prices for Medicare, which is something that Trump criticized in the briefing, though he didn't say what he would do differently. But anyways, right, the numbers that he promised, they are huge, though you've some saying take it with a grain of salt because it's Donald Trump.
60, 70, 80, 90%. But actually more than that, if you think about it in the way mathematically.
Now, with all this, you might be surprised to hear that pharmaceutical stock prices actually rose after this announcement, with the belief that the apparent reason for that is that the industry was expecting something much harsher from the administration, such as congressional legislation or regulations changing how the government pays for certain drugs. And that is, you also had Trump claiming that this will actually increase revenue for the industry because it'll raise prices abroad. Right, so for example, the order directs the U.S. Trade Representative and the Commerce Department to take action against what it called unreasonable and discriminatory policies in other countries that keep their own prices lower, with officials saying they'll focus on lowering prices for drugs with the highest cost disparities between the U.S. and other developed nations whose government-run healthcare systems Trump doesn't like.
This means American patients were effectively subsidizing socialist healthcare systems in Germany, in all parts of the European Union. They were the toughest of all. They were nasty.
Though right now, it's unclear how much leverage the U.S. actually has over other countries, since they're already locked into contracts with American drug makers and they can decline to cover the drugs at all if prices go up. But, in response to this, while there's been some criticism that the move doesn't go far enough, or it's not the right kind of action, or that U.S. patients get quicker access to drugs because of the higher prices, the general reaction seems to be mostly positive, which, isn't surprising because lowering drug prices is one of the issues that's popular among both Democrats and Republicans, or at least Republican voters. And so one of the examples you had out there was Mark Cuban, a Democrat, just firing off praise on social media for the move, saying, "Gotta be honest, the Trump EO on healthcare and in particular drug pricing could save hundreds of billions." With him then listing a ton of different ways that the Trump administration could get drug prices down, notably by regulating the industry and targeting pharmacy benefit managers, or PBMs. And we've talked about them before. They're basically middlemen who negotiate between insurance companies and pharmacies, and critics argue they profit off artificially inflating prices. And so you have Cuban claiming that the level of opacity that the big PBMs create is why the price of drug brands are outrageous, with him then also taking the opportunity to promote Cost Plus Drugs, which is the company that he founded a few years ago to offer lower priced generics by cutting out the PBMs. With all that said, of course, this is breaking news. We've got to see what comes from the executive order, whether it's actually effective, and whether it's followed by any durable legislation, especially because the other big bit of healthcare news right now is that the House Republicans' budget plan would cut hundreds of billions of dollars from Medicaid, throwing millions of Americans off their insurance, and it contains nothing about lowering drug prices. Hey, thanks for watching, and I hope you enjoyed this clip from the full Philip DeFranco show. And also, a big thanks to Squarespace for sponsoring our Clips channel. Turn your passion into profit over at squarespace.com/Phil, or use the QR code. Because whether you're launching a business or a lucrative side hustle, your website is your digital business card. It's the only space where you control the story, no algorithms or distractions. And with Squarespace, it's so easy because they got a ton of stunning professional templates with drag and drop editing that makes site design incredibly simple, no coding required. So get started for free at squarespace.com/Phil, or scan the QR code on screen and use code Phil for 10% off when ready to launch. Squarespace.com/Phil.